Got ear fullness after diving, or maybe a bit of pain or even blood? Yep, that's probably barotrauma, and it's happened to freedivers way much more often than you think. According to research, about 41% of freedivers show some sign of mild ear barotrauma after dives, and it's correlated with your experience, depth, and frequency of dives. Hi, my name is Daria. I am an ENT doctor and also freediving lover from Indonesia, and today we talk about ear barotrauma, the most essential things: how to recognize it, what to do if it's happened, and when you really need to see a doctor. Only practical tips. And we also will boost some myths about recovery period and ear drops when you have ear barotrauma. If you're new to your ear and you don't know what is middle ear, eustachian tube, check those videos so you will fully understand what will going on here. So let's go quickly through the basics to understand everything better. Barotrauma is what happens when your ear fails to equalize during pressure changes, usually on descent. When the pressure outside increases but you don't equalize, your middle ear space collapses inward. The eardrum gets pulled in, tiny blood vessels expand, tissue swells. Basically, your ear's trying to fix the pressure problem on its own. If you still don't equalize, your ears will equalize itself by rupturing blood vessels, causing bleeding and fluid buildup, or even tearing the membranes. It can happen both on descent or ascent, but descent barotrauma is more common, so we will focus on it today. The main cause of ear barotrauma is insufficient equalization. It can happen because of anatomical or technical reasons. When we talk about technical reasons, it's when there is some problem with your equalization or technical freediving. For example, you descending too fast, or you use forceful equalization, or maybe you equalize not often enough, or you're leaving one ear unequalized. When we talk about anatomical reasons, and when your eustachian tube not working properly, because cold, allergies, sinus infection, or any other nose congestion. That's why people with ENT problems, previous perforation, or beginners are more at risk because lack of technique or some pre-existing health problems. Data even shows that experienced freedivers have much lower rates, so skill is protective. It's really important if you had barotrauma to take a moment and reflect what went wrong and where exactly the mistake happened. Barotrauma is divided into 3 degrees: mild, moderate, and severe, and treatment strategy depends on the severity. Barotrauma is the most common. Around 40% of beginners get it, and it's characterized by fullness, pressure, and mild pain in your ear. Small blood vessels on the eardrum stretch or break. Sometimes small bruises appear. Your eustachian tube could be blocked or swollen. When we talk about moderate barotrauma, it's when the things get juicier, literally. You might have blood or fluid behind your eardrum. People often say it feels like there is water in my ear, or I can hear it sloshing. The common symptoms are pain, muffled or echoing hearing, and that annoying water inside feeling. When we talk about severe barotrauma or eardrum perforation, it's quite rare in freediving. The average eardrum burst pressure is around 97 kilopascals, basically the same as the pressure change on fast descent without equalizing from the surface to 10 meters underwater. The common symptoms are pain, that then pop sound and release of pressure, dizziness, cold water rush, sometimes blood discharge, and this special shh sound when you equalize. So what to do in the water? The first important rule: if you feel pressure or pain in your ear, you need to stop diving and don't push through the pain. Sometimes your eustachian tube just swell a bit after 6 or 5 dives, so you need to have a rest, open your mask, breathe through your nose, and do some jaw movements to restore the balance. After 5 or 10 minutes of rest, try to equalize, but really gentle and softly. If it goes smoothly and you don't feel any pressure or pain anymore, you can continue diving, but don't go too deep and always listen to your ears. But if equalize and pressure and pain persist in your ear, you need to stop diving for today. Your ears really deserve a break. And if you suspect eardrum perforation, keep your ear dry and get back to surface right away. If it hurts, just blow harder. No, that's how exactly you make the things worse. You will increase the degree of your barotrauma, because forceful equalization when you have barotrauma will increase the pain and lead to microvessels rupture. A few drops of alcohol or peroxide will help. Nope, it could work if you have outer ear infection, but when you have barotrauma mild or moderate, it will not work at all. But if you have eardrum perforation and you use these drops, it will burn like crazy and can increase the damage. You can't dive again for months. Usually not true. In mild cases, it's just few days. In moderate cases, it could be 10 days or 2 weeks. And if you have eardrum perforation, it depends on degree of perforation and healing. In mild and moderate cases, it's really important to rest your ear for 24 hours, no equalization at all, because your eustachian tube is swollen and blocked. And if you forcefully increase the pressure inside your middle ear, it can lead to microvessels rupture, blood accumulation behind your eardrum, or even eardrum perforation. If you're not congested, use nasal decongestant spray for 3 or 4 days. Add antihistamines if allergies are involved. Take pain reliefs, paracetamol or ibuprofen. In this period, you also can do some jaw movement to softly open your eustachian tubes. Drops are not really effective in these cases because the problems stay behind your eardrum. So you rest your ear in 24 hours and observe. If after 24 hours you don't feel pain anymore, you can try to equalize very softly and gently. If you feel pain, resistance or pressure when you equalize softly, just wait for a few more days. So when you need to see a doctor in mild or moderate cases. First, when you get an ear discharge, blood, clear or pus. When you feel unwell or fever. If the pain still exists more than 24 hours. If you get any dizziness or balance problem or hearing loss or ringing. Because these signs can be symptoms of infection or inner ear barotrauma. So what to do if you have eardrum perforation? After you visit an ENT doctor, keep your ear dry. It's really important because water entering your ear increases the risk of infection. It significantly reduces the chances of healing. Second, avoid pressure changes. No diving, no flying, no going to mountains, no equalization at all until your eardrum fully healing. You also shouldn't blow your nose too hard, or when you're sneezing, better open your mouth to avoid any pressure build up in your nose. When we talk about antibiotics, oral or topical, it's not really necessary until infection is suspected. Small holes usually heal in 3 till 8 weeks. Large one may need surgery. In mild and moderate cases, once you can equalize freely without pain and when your ear feels completely normal. For eardrum perforation, when your eardrum is fully recovered and your eustachian tube is working at full capacity. Barotrauma is common but entirely preventable with knowledge and good habits. Understand how your ear works, equalize gently and early, and give them time to recover. And if you want to learn free diving from a medical point of view, don't forget to subscribe and let's keep diving smart.